Morning, all of you. Thank you very much for having invited me. Palghar is has a lot of emotional attachment. I have an emotional attachment here. I started my clinical work as an intern after MBBS over here. In 6 months, I worked. Dr. Runde was our medical officer at that time in the PHU at Palghar. And of course, I have a lot of friends. Surya is one, Rajendra Chavan is there, Naina is not here, Naina Tendulkar, they are all my friends. So we have a lot of friends also here. Of course, as Surya said, that I am basically a pediatric surgeon. I have been a pediatric surgeon all my life till now. And it's only since the last about 2 years that I have always been interested in improving healthcare. I have worked on improving healthcare during the Association of Medical Consultants at IMA. I've been the president of our local IMA also. And I've been working on this. And now last 2 years, I'm quite a lot into this, trying to improve standards of healthcare. I did a course, Harvard course, during the COVID time, and from that I got inspired. And then we have started this. So we all know that, and we all do believe to a certain extent that medicine is a noble profession. And why is it a noble profession? Because we as doctors are capable of offering physical as well as mental and emotional relief to a stressed patient, to a person in pain and person in discomfort. And this is a very, very special power which we all have. At the same time, to earn our bread, to earn money is our right, as a fundamental right, and it also becomes our duty towards our family. We often feel that there is a tug of war between this right to earn and our duty as somebody who has to heal. Actually, it should not be a tug of war. It is something like balancing our skates. On one hand, the right to heal, and the other hand, right to earn. And that is what we have to aim at. Now, when we are looking at our challenges in private practice, today, as you can see, our previous speaker has just told us so many things about infections. I mean, the spectrum is changing so rapidly, and that's just in infections. And everywhere the spectrum is changing, it's expanding very, very rapidly. And it is just not possible for any one of us to really remain updated into all medical knowledge. Unfortunately, at the other end, the patient's expectations are also rising very rapidly, because they are reading on net, they read on something on social media, and they feel that, well, if I have read it on the net, why have you not read it? And if they have sent something on social media, they expect that you should have. Now, they have read one point, but we can't, that every one point, everybody cannot be more reading. So it's just not possible. So they expect that you know about this. And when we are not able to really respond adequately, they feel that, you are not good enough, they become disloyal to you, they become at times even violent because you are not reaching up to their expectations. As if this was not enough, today now the courts have also been very, very harsh on us, and they feel that if we have not taken a specialty opinion at the correct time, that is amounting to negligence. So that again comes against us. So we have to find some solution to our problems. Now, as I said, once again, when we are looking at private practice or typical practice scenario, we have a large bunch of routine patients, and at different levels, when they're at general practice, at surgical level or at physician level, there is a large spectrum of routine patients, and that comprises about 80 to 90% of our patients, which is any of these things. But there is going to be a small percentage, and this routine patients is something which whoever, as doctors, whoever is there, is able to manage very efficiently. We keep learning a little bit, but we really manage efficiently, and there is not much to be done about it. And as I said, we just have to continue to manage. we come into the place where there are special problems. Now, where do these special problems come? Any of these routine symptoms persisting for a very, very long time, then it becomes a special problem. Any of these routine symptoms keep coming again and again, as what doctor said, that fever coming off and on for last 6 months, so then that was something which was unusual. Or any of these routine symptoms gradually increasing continuously, again a special problem. Of course, at the other end, there are unusual symptoms, again which will require some sort of reference. It could be swellings, it could be unusual rashes, it could be gait abnormalities, it could be muscle weakness, any of those various things which are special or unusual symptoms. There are obviously surgical symptoms, hernia and all that. When you are looking at private practice, now these obviously will require a surgical referral because you know that this is not something which you are going to handle. Now, normally when this sort of referrals are required, what do? You refer to a specialist or a bigger center. That's a standard procedure which all of us would be doing. Obviously, when you are looking at from wherever you are practicing, patient will have to travel a little bit, spend money. There are times when there are long waiting time periods, fear of cross-infection, especially during COVID it was more, but even otherwise when you are going and waiting in big hospital queues, there is a possibility of cross-infection. Because there is a fear of travel, there is an expense of travel, the patient delays going, very often you advise and the patient still delays going there. Now if the patient delays going there, at that time, the specialist at that time starts blaming you as well as the patient that why you have delayed. So that is again the problem. So if the patient delays, then again the problem comes onto you. At times, there is just a mild change in medications that have to be done, especially when we are looking at NCDs, diabetes, hypertension, some minor change in medicines, and the patient feels dissatisfied that he had to travel a lot just for a minor change in medicine, and he sort of again loses faith in you and he feels that you were just trying to shirk your responsibility, throw away your responsibility by sending him away to a big city, and he gets dissatisfied with all these reasons. So this is where pyramid comes in. It is not coming into any of your routine problems, and routine problems you continue to handle as you are handling. Pyramid comes in at these stages. So it's a health tech startup which is convinced about the essential role of family practitioners or primary practitioners. Whoever are the primary practitioners, we expect that you continue to be doing your job and we really don't want to have interfere with that. Unlike most telemedicine platforms which are directly connecting to patients, Pyramid does not directly connect to patients. Pyramid connects only doctor to doctor. So only the primary doctor decides when to discuss a case with a specialist, and he or she decides when to discuss a case with the specialist and he consults. The concept of pyramidal healthcare, where the primary doctor is in charge of the patient, remains in charge of the patient, and he decides when to discuss or refer this patient to a higher center. That is the pyramid, and that is why we call this pyramid. Because this concept is comparatively unique of pyramidal healthcare, which we are following in telemedicine. We have been awarded the SHF award this year for excellence in telemedicine. So what exactly do we do? B1 is the primary doctor, whoever is the primary doctor. So the patient is with them. The primary doctor realizes the need for a specialist opinion. As I have said, either unusual symptoms, persistent symptoms, recurrent symptoms, you feel that now this patient requires a specialist opinion. You select the specialty whom you want to discuss, because very often when the patient directly decides he doesn't know which type of specialty that he needs to refer to or consult, as a primary doctor, you will be able to decide that I want to discuss this patient with this sort of specialist or this sort of super specialist. So that means you are far better oriented to decide what type of specialist. You decide the specialist from our panel, which we have got. Right now we have about 450 different specialists. We are expanding. We are comparatively very new, just as I said, started about 2 years back, but really became functional about a little over a year back. And so we are expanding our panel. We are not restricted by any hospital. We are not restricted by any particular group. So any of you or all of you who are consultants here are welcome to join the panel. So there is absolutely no restriction on that. We are interested that more and more people become available for giving a consultation opinion. So the patient patient is with the primary doctor. He fixes up an appointment with the specialist on the app itself, and at the particular time does a video consultation with the specialist. And the advantage is that the primary doctor is able to convey physical signs, is able to convey relevant investigations to the specialist, and discuss the case with the specialist. He offers continuity of care also to the specialist, to the patient. Unfortunately, otherwise, when a patient directly consults a specialist, especially on a telemedicine platform, it's an episodic consultation. Here, we are able to offer more continuity of care. And at the end of it, there is an electronic health record which is generated. And that electronic health record can be shared with the patient. You can share it with any other this thing. So we feel that 50% of those special problems where you would like to refer a patient can be sorted out in this particular manner, and approximately 50% that you discuss the case with the specialist and you sort it out. That means we are giving sort of point of care treatment. The patient does not need to travel, the patient does not need to be going away from you. And in the other remaining 50% of the problems also, the specialist is able to help you and the patient, because an initial workup can be done. Initial workup and investigation, suppose it's a surgical case, obviously surgical case, but initial workup and investigations can be done. Patient does not have to travel for doing those things beforehand and directly come for surgical. So suppose it's a thing which cannot be done in Palghar, or it's not being done in Palghar area, if you need to send the patient to Bombay, but if the initial workup is done, then the amount of time that the patient has to spend in the hospital, it's Leelavati or whether it's Hinduja or any of those places, it becomes much shorter. So that means the patient can come out from there faster. Luckily, because you are already in touch with the specialist, even the discharge can be initiated faster. So whether it's for surgery, whether it's for other medical admissions, the initial workup can be done by you under the supervision of the specialist. Because the patient and the specialist are already connected, so that means the connection between the specialist and the patient has already been done. So that means again that connective time becomes lesser, and follow-up can also be done as far as investigation and treatment is concerned, also can be done by you. So that means the patients, so that means we would be able to help the patient to reduce his stay in the city or travel to the city significantly. As far as the referring doctor is concerned, by the way, each such consultation is a paid consultation. We are not routinely doing free consultations. However, if there is a need for doing a free consultation, you can contact our helpline and we will work out a free consultation. But otherwise, routinely each consultation is a paid consultation. And from this consultation, because this is a joint consultation, so we are ethically allowed to share the fees between the primary doctor and the secondary doctor. The fees are for different specialists are mentioned on the app itself, it's there, and whatever fee is paid, that fee is shared between the primary and the secondary doctor. Investigations are done through you, so that means the patient remains with you. In case some of the investigations are not possible locally, then we can depute some of the labs and send to pick up the investigations also if possible. So that is also a possibility. Treatment is done through the primary doctor, so that's the advantage. The patient remains with the primary doctor. The primary doctor gets to retain the patient with him. He is not he is not sending the patient away. In case of admission is required, again you are in touch with the specialist, because pre-operatively itself, pre-admission you have been in touch with the specialist, so that's an advantage. Post-admission treatment and investigations are done through the primary doctor. There is always a learning process, because whereas CMEs and all that, we keep learning. I mean, we have been participating in these CMEs all these years that I have been into practice. But the fact is that a lot of it is theoretical talking, except for some of the case reports which were just shown to us by a madam, and that is good, because then you are sort of case-based learning. But otherwise, each case the primary doctor managed to learn a little bit, and that is a big advantage in the process. Of course, you will connect to a variety of specialists through the app very easily, and on top of it, the main thing is that you are also getting medico-legal safety, because at the correct time you have taken an opinion from a specialist or from a super specialist. So even if you are running a surgical hospital or you are running a medical hospital, a physician, those who are, if you require to take a gastroenterologist's opinion, you take an endocrinologist's opinion, you take a neurologist's opinion at the correct time, that will help the patient, and it will also give you great medical legal safety, because nowadays that is something which is also something which we need to be taking care of. As far as the secondary doctors are concerned, those of you who are consultants, you can enhance your network of referring doctors, because we are continuously contacting more and more primary doctors. Because of this, you are able to use your specialized knowledge more effectively. Today, if I am a pediatric surgeon, I would like to use my knowledge as a pediatric surgeon maximally for advanced pediatric surgery, not for doing CLW surgery. Unfortunately, what happens is that if I don't get enough pediatric surgical patients, then I concentrate on CLW surgery, and that is not very fair, because there are enough number of people who can do CLW surgery. I don't need to do that as a pediatric surgeon. But that's what's happening in many fields. We are well aware of it. I mean, I have been as Surya said, I am active in Association of Medical Consultants for 20 years. I've been a past president. I know the scenario that in the cities, there's a lot of redundancy of specialists. There is not enough work for specialists, so they keep doing small work. That's not what they became specialists for. They became specialists for doing good work, big work. And because of now, as a specialist, if you can sort of contact patients from far off, you can concentrate on specialty work. You don't need to then do small work. There's nothing wrong in doing small work, but there are people who are there for doing all the routine work. Then why should you do that work? That sort of thing. So, as a specialist, you have a possibility that you can use your specialized knowledge for more and more patients. You can ensure a better patient connectivity pre-referral as well as post-referral, because through the doctor you are able to connect this, and you are able to strengthen your referral bonds, because as a specialist, whoever is there. So that is the advantage. And for hospitals, those big hospitals who are there, we have another scheme, what we call a True Blue network, where they can create a very dedicated referral network through PyraMed. And if there are, I don't know, the person from Zavale's hospital is not there, but otherwise whoever are running big hospitals, please, we will tell you what the True Blue network is. You can enhance your referral network much better and strengthen your referral network through this. So that is the whole purpose. Idea is to take point of care treatment to as much as possible and still ensure that this point of care treatment is quality treatment. And that is what we need to ensure. Of course, patient saves a lot of time and money. There is continuity of care, as I said, because it's not episodic treatment. Patient realizes that the primary doctor is well connected, so his loyalty to the patient increases. The very fact that the urban specialist has faith in you, he is giving treatment through you, again improves the loyalty to the patient. You are able to diagnose early because you are not reluctant. Even at the slightest of suspicion, you can take a consultation, you can take an opinion, and because of early diagnosis, patient saves money, patient saves his health. Blame games are avoided because you are in direct touch with consultants. Otherwise, there is always this fear that when I send the patient to some wellness thing, there is going to be some blame game which is going on. So you are avoiding because you are in direct touch. And all this is going to lead to patient happiness. It improves the status and it improves the stature of the doctors. And that is extremely important. Because finally, if healthcare and healthcare environment can be made safer and healthier, we as doctors would raise our standards. And it is we doctors who will have to work to raise our standards. We cannot leave it to the government to help us to raise our standards. We cannot ask the pharmas to raise our standards. They are all going to work for themselves. So it's we as doctors who have to work to ensure that we raise our standards and we offer more and more and better care to our patients. That's what the whole purpose is. And that is what PyraMed is trying to do. Thank you. If we have 2-3 minutes, I will just run through how the process runs. Is it, you have 2-3 minutes?
Yes.
So basically this is just an app. It's called PyraMed. You go to the Google store and download the app, install it. This is the opening remark. You just press on get started, and you will be asked to register or log in. Now those of you who have filled up the form outside, we will be doing the backend registration process for you, and we will be sending you the password link. So you just have to set your password, use the same email which you have put on our form, and you can log in directly. Otherwise you can, those of you who have not filled up the form, or they can, even those friends of yours, if they want to do it, you just do register now. The form it's an online form, you can undo your online registration. We are opening this app only to doctors, so we require a registration number and the basic details of the doctor, because this is, as I said, purely a doctor to doctor app. It is not a patient to doctor app. So we are taking those details. It's medical legally also, because the health record which is be generated will mention that this doctor discussed this case with so and so doctor, and this is the opinion of the specialist. So that is what the way the whole medical record is generated. It's a joint medical consultation. So it's a joint consultation app. So we require the registration numbers of both the doctors. So as I said, then you just log in with this, your email ID and your password which you set in, and this is going to be the home page. As soon as you want to discuss a particular patient, you add a patient, and if you are busy, you can just ask your patient to phone us up, and we will take down all the details and allot that patient to you. So if the patient phones me up, phones our department and says that I am Dr. Surya Raju's patient, and these are my details, then we will take down all the details and we will just allot that patient to Dr. Surya Raju. So that means on Surya Raju's app, this patient's name will be seen. So when you want to take an appointment for this particular patient, within 2 minutes, this patient will be seen on your app. If otherwise, you can fill up the details. Both options are open. You can fill up the details of the patient, and the patient will be seen on your app. So when you want to take an appointment, just go to this tab down over here. Is there a sorry? No. Sorry, yeah. So you just go to the patient. So you go to the patients tab there, and you will be able to see your patient on this, and once you click on that patient, you have to decide schedule new appointment. You can see the second option there, say schedule new appointment. You decide whether pediatric specialties or adult specialties. We have roughly about 35 different specialties already. So pediatric and adult mix, okay. So you can decide whether there is adult specialty or pediatric specialty, and then just select one of the specialties. This list is there. You can decide select one of the specialties, then select the particular doctor you want from the particular specialty. As I said, the fees as well as little brief information of that particular doctor is available on that app itself, and fix up the appointment. The appointment schedule of the doctor is available. It is there, so you fix up the appointment, and at that particular, so as soon as you fix up the appointment, you will get a SMS that your appointment has been fixed up with so and so person for so and so time, and you will get an SMS, the patient will get an SMS, similarly the consultant, the doctor will also get an SMS, and your appointment is fixed. And once you do this, give us some more information about the patient so that it becomes much better for the consultant to opine. Just some basic, some past histories, some past surgeries or any of these things. And these are templates which are specialty based. So that means whether for cardiology, like this is the template. So common symptoms which are there, you can just tick mark and give them, so that all this is all template based, so that it becomes much simpler for you to discuss that patient. And all this information, when you give, immediately it goes to the consultant and he is aware of this. You can also upload reports, just click on the photographs of the reports and upload them. And at the time of the appointments, then you go to the third tab and just start video calling. And when you do video calling, just stabilize the phone so that you can do a video calling in a nice way, so that the patient and you are together. And this is how the consultant sees on his laptop or a desktop. If when you join as a consultant, you will be joining as a, you don't have to use the app, you will use a desktop or a laptop as a specialist, because here you have to have the video call, you also have the notes, and you also have the investigations, all in one screen. You can fill up the notes, you can enter your notes also at the same time, where in the central portion, you can enter your notes and make your final listing. So when you are doing the video call, you can enter your notes also at the same time, and finally at the end of the consultation, a health record is generated. So this is what the whole process is. This is the last, this thing is the health record. So it shows whatever information was available, was given by the primary doctor, whatever reports were uploaded by the primary doctor, what is your opinion, what is your opinion which you have advised, everything is mentioned in that particular thing, so that that can be shared with the patient also, and that's something which is required for you medically also. Yeah. Thank you. Any questions? Yes. Thank you. We are trying to make this more popular, so that, as I said, we can take point of care, like what she just said. One of the most important things for treatment is going to be diagnosis, and one of the most important aspects of diagnosis, the first aspect of diagnosis, is a good consultation. Random investigations don't really achieve anything. As what she has said, that random treatment, you start second line, third line antibiotics for something which could have been treated with doxycycline, and that would make all the difference. That if we are able to do a good consultation, it's going to help the patient, it's going to help our profession, because we will be able to elevate the level of our profession. Thank you.
Sir, it was a nice presentation and a very good app. I see quite a very bright future for this, like digitalization of money. I think this is also a need of time, and it can extend to all this rural area also. And one point which you forgot to tell, which I need to say, that it is not necessary that only a patient or a general doctor or a consultant is involved, but a consultant like us who are here for old timers, who also need some advice from the advance, that also can be added in this, and that will also be very helpful. So I think it was a very nice app.
So as a super specialist, I require, as a pediatric surgeon, I require at times to get a pediatric endocrinological opinion. So I take a pediatric endocrinologist opinion because of my this thing, or a pediatric gastroenterologist opinion. So it's not necessary that only a GP has to use it. Any primary, as I said, when I'm treating a patient, I require a pediatric endocrinology opinion. Yes. Now we are also giving this to anesthetists. Now what happens is that most anesthetists nowadays would like to do a pre-op assessment of the patient, and they will be expected to go and see the patient at the hospital to do a pre-op assessment. So what happens is that just ask those who are practicing anesthetists, ask the RMO to upload the reports. This thing all does to be done directly, and you can do a pre-op assessment. You don't need to travel to the hospital to do a pre-op assessment, and you have already done a pre-op assessment. If something has to be done beforehand, it can be done. So all this is, I mean, we have to use digital technology to the best way possible thing that we can use. So thank you very much, all of you, and thank you very much as an association for giving us this time. Thank you very much.